Becoming a doctor was, I think, a combination of a good fit personality-wise for me, as well as being good at sciences and just having a curious personality. What I should say is more of a inquisitive personality when it comes to thinking about how things work. Outcomes are without doubt better for patients when their cases are discussed in multidisciplinary tumor boards, and that's been proven over and over again. In fact, I would go far as to say that patients whose cases are not discussed in tumor board, even if these are garden variety or bread and butter medicine cases or oncology cases, I would say those patients get inferior care. I grew up in many different parts of the world. The United States and Pakistan are just two of the places I've lived. I've also lived in Europe and Southeast Asia, and you just get to interact with a lot of different cultures and in a way assimilate every time you move, and that's really helpful in medicine in general. It helps you make a connection with people, and that connection is really important because it helps establish trust between a patient and a physician, and the better you can do that, I think the better you will be able to help take care of people. Don't worry about what you've heard. Let's try a certain treatment and see how you feel. And actually watching them go through the treatment and feel better and come back and tell me how they're enjoying life and going out with their families and living their lives. That, I suppose, the most satisfying thing a patient ever told me was, "Doc, I forgot I had cancer." We have nurses who bring guitars to the treatment area, especially around the holiday season, and they play songs and beautiful songs, and some of the patients just sit there and they're crying. They're listening to that, and it's just the raw emotion of just doing something for somebody else for the sake of helping them, making them feel better, and it's good. It's a good feeling. I would say to them that we're here with you, and we're going to take care of you. You want them to forget about their illness. You want them to come back and tell you, "Hey, I feel like a normal person again."